stuff today.
Yeah.
You send us all this stuff about Stephen Rickett, and we've got medical records, and there's brain imaging too. The MRIs and CT scans.
Yeah.
We've got
also a lot here.
Yeah, and then there's all this stuff from the VA.
Yeah, VA documents,
Right.
decisions, and
Personal communications like emails.
yeah.
And
even some info from this veteran support organization called the Patriot Cabin Community.
yeah, I was looking at that. So
It's a lot to unpack.
how are we going to get through all of this?
I think the first thing is to really zero in on what are the main health issues that are going on with Stephen Rickett? I mean, based on all this material,
Right.
and then we can look for any patterns
Yeah.
or inconsistencies.
One of the things that really stood out to me right away was there was this brain MRI from December 15th, 2023. And there was a note on it, and it just said, "Is this a pituitary gland tumor?"
Oh, wow.
Yeah, and so I was like, whoa, okay, what's going on here?
Yeah.
And then we've also got
Yeah.
a CT scan of the head
Uh-huh.
from the VA
Oh, okay.
dated March 4th, 2025.
All right.
And the reason they did that scan was because he has a history of something called occipital transient visual obscurations.
Mm-hmm.
Those
are those temporary visual disturbances.
Exactly, like TVOs and migraines.
Right, so visual stuff and headaches.
Yeah, so let's maybe start there with what he's been diagnosed with.
Okay, yeah, so I think we should definitely unpack this, starting with this adrenal tumor.
Okay.
The VA decision documents clearly say that it's service-connected,
right,
directly linked to his military service.
Okay, so that's a big deal, right?
Yeah. That's a huge piece of information right off the bat.
But then it also says non-compensable evaluation.
Yeah. Okay.
Effective August 10th, 2022.
Interesting.
And they say that's because even though it messes with his, endocrine functions,
right,
it doesn't fit into their category.
Yeah, they're little boxes in the rating schedule for compensation.
Yeah, exactly. They're boxes.
Right, right.
But what's interesting is we've got these earlier records that give us some background.
Okay.
So there are treatment notes from the Columbus VA from August 25th, 2017 that mention this thing called an 8-millimeter livid Leyden adrenal adenoma.
Yeah, so basically it's a small non-cancerous tumor on the adrenal gland. And then later on there's a CT scan of the abdomen done on September 28th, 2022.
Okay.
And it shows that this tumor had grown a tiny bit to 9 millimeters, still on the right adrenal gland.
So it hadn't changed a lot?
Right. It was a very gradual change, which, could be important in terms of how they monitor it.
Yeah. Yeah, for sure. And the examiner at the time actually connected this tumor to potential toxic exposure.
Okay.
During his service in Southwest Asia.
Interesting.
And they said, just watchful waiting because it was benign.
Right. So service connected, but not compensable, at least for now.
Exactly.
Right.
Okay. So that's one thing of the puzzle.
Yeah. One piece of the puzzle.
Now let's look at the brain imaging.
Yeah. And that question about the pituitary tumor.
Right. So that December 15th, 2023 MRI has that really specific question on it.
Yeah. Is this a pituitary gland tumor?
Right. And you have to understand that just an image by itself, without a report from a radiologist, can't really give us a definitive answer.
Yeah.
But the fact that that question is even there means somebody saw something.
Yeah, exactly.
That made them wonder.
It makes you wonder what the radiologist said.
I know, right?
Yeah.
What did they think?
Yeah.
And then there's that CT scan of the head. Right. The one from March 4th, 2025.
Right. Without contrast.
Yeah. And they did that because of the...
Yeah, because of those...
occipital TVOs.
Right. Temporary vision problems.
Yeah, and migraine.
And the headaches, right?
Yeah.
So they put in some of his clinical history, too.
Okay.
They mentioned the brain MRI he had around 2023 for TIAs.
Okay, right. Yeah, TIA.
Ischemic attacks.
Yeah.
Mini strokes sometimes.
Right.
And they also noted that he hadn't had a recent carotid ultrasound.
Okay.
So they hadn't checked the blood flow to his brain.
Oh, okay.
And that he hadn't seen a neurologist very often since before 2020.
Interesting.
Yeah.
And the findings from that CT scan.
Right. They're very detailed.
Yeah.
It says age-appropriate atrophy, which is normal for aging.
Okay.
No evidence of acute intracranial hemorrhage or mass effect.
Right.
And the gray and white matter look normal.
Okay.
The ventricles are normal size. No skull fracture.
Yeah.
But here's something interesting. It mentions these chronic appearing, non-specific subcutaneous scalp nodules.
So like lumps under the skin.
Yeah, basically little lumps under the skin on both sides of his scalp.
Huh. Interesting.
But the main takeaway is that the impression at the end of the report clearly states no acute intracranial abnormality identified.
Okay.
And they even compared it to his older MRIs and CT scans.
Right, from December 2019.
Yeah, so even though that earlier MRI had that question about a pituitary tumor, this CT scan didn't find any big problems in his brain.
Yeah, but I mean, MRIs are better for soft tissues.
Exactly, an MRI might show something that a CT doesn't.
Yeah, so it doesn't totally rule it out.
Right, it just means we don't know for sure without seeing that radiology report for the December 2023 MRI.
Yeah, was there even a report?
We don't know, do we?
Yeah.
That's a gap in the information.
Totally. Okay, so switching gears now.
Yeah, let's switch gears.
Big time. We had this email from March 27th, 2025, where Stephen Rickett lays out all these.
Oh, yeah, this email is intense.
Yeah, it's a lot.
It is.
The subject line is malicious, willful, deliberate, and intentional negligence, malpractice, and violation of patient rights by the Columbus and Chillicothe VA systems.
Wow, that's a mouthful.
Yeah, and he doesn't hold back.
He's not messing around.
No, he's not.
He's got a formal complaint in there alleging all this denied care and what he sees as straight-up malicious treatment.
Right, and one of the things he keeps saying is that they're not telling him the truth.
Right, he says they're withholding information about his health.
Yeah.
Which is really scary.
Yeah. How can you trust the system if you think they're not being straight with you?
Exactly. And he says this negligence has made him and his wife, Jessie, much sicker.
Right.
And he's tried everything.
Yeah. He says he went to the VA patient advocate, the VA Office of Inspector General.
Wow.
Even Congress.
And nothing.
And he says nobody's done anything.
That's so frustrating.
It is so frustrating.
Okay, so let's try to break down some of his specific allegations.
Yeah. Because there are a lot.
Yeah, one of the main things he talks about is this alleged systemic negligence.
Right.
He says there are problems across tons of departments in both the Columbus and Chillicothe VA systems.
Yeah.
And he says they're directly responsible for his declining health.
Yeah. And he lists all these things.
Right. Multiple tumors, cancers, cysts, and other treatable conditions that he says were never diagnosed or treated.
So he sees it as like a huge system failure.
Yeah, he thinks the whole system is broken.
Yeah. Okay. Then he talks about failure to review and act on medical records.
Right.
And he says they're withholding or even changing crucial findings.
Wow.
Because his conditions are service-connected.
So he thinks they're doing this on purpose because he's service-connected.
Exactly.
That's a serious accusation.
It is. And he also questions why they're looking at records from before 1991.
Right.
Because that's when he got medically discharged from the Marines.
So he's saying those records shouldn't matter.
Yeah, he's like, why are you even looking at those?
Right, like his service-connected issues should start from his discharge.
Exactly.
It makes you wonder how the VA handles all those old medical records.
Yeah, for sure. Yeah. Okay, so then he gives some really specific examples.
Okay, like what?
Well, remember that adrenal tumor?
Yeah, the one from 2017?
Right. He says they found it then, but didn't tell him until February 14th, 2024.
What?
Yeah, and only after he had an independent C&P exam.
Wow. That's a huge delay.
It is.
Like you said, that's not just a little oversight.
Right, it could have impacted his treatment.
Exactly, and his understanding of his own health.
Yeah, and Reese's questions about how they communicate within the VA.
And then there's this whole thing about Dr. Fulop.
Yeah, he says Dr. Fulop kept labeling him as a malingerer.
Oh, wow.
And we actually do have a document from December 17th, 2019.
All right.
And it says somatoform disorder, entered by James Peter Fulop at the Chalmers P. Wiley VA outpatient clinic.
So not exactly a malingerer label.
Right, but it kind of implies the same thing.
Yeah, like maybe his symptoms aren't real.
Right.
Which is really damaging.
Yeah, because then they don't take you seriously.
Exactly.
He also talks about problems with his FOIA request.
FOIA, right? Freedom of Information Act?
Yeah, he says they're making it really hard for him to get his own medical records.
Oh, wow.
Yeah, he even says they sent him an empty envelope once.
Are you serious?
Yeah, it's crazy.
That's messed up.
Totally. And then he talks about delayed and denied specialist referrals and a lack of diagnosis and treatment.
Right.
He says he's been blackballed.
Blackballed, wow.
Yeah, he says they ignore his complaints.
That's so awful.
And he even quotes something from 2000.
Really?
Yeah, he says they said no tests, no diagnosis, and no treatment equals no issues.
That's chilling.
It is, right?
Like, if that's their attitude, that's really messed up. And then he lists all these specific conditions that he says haven't been dealt with.
Right, like malignant melanoma, basal cell carcinoma, the adrenal tumor, renal cysts, and that pituitary tumor.
The one from the MRI?
Yeah, and he says he still hasn't gotten any results from that MRI.
So all these unanswered questions.
Yeah, it's no wonder he doesn't trust him.
Yeah, I can see why he's so frustrated.
Yeah, and then there's Dr. Forbush.
Okay, who's that?
This neurologist in Newark, Ohio.
All right.
He says Dr. Forbush limited his examinations.
Okay.
And ignored his symptoms.
Like what kind of symptoms?
Well, he had elevated inflammatory markers, shortness of breath, difficulty breathing.
And he just ignored them?
Yeah, he says he just brushed them off.
Wow. Okay, so what else?
Well, he also claims he was diagnosed with a TIA back in 2014.
A TIA?
Yeah.
But he didn't get treated until 2025.
Yeah, March 2025.
That's a long time.
It is. And then there's the pacemaker issue.
Okay, what about a pacemaker?
He says he needed one for like a day. But now the VA says he doesn't have one.
So what happened there?
We don't know.
That's weird.
Yeah, and then there's this whole thing about the syncope clinic.
What's that?
It's a clinic for people who pass out.
Okay.
He says the VA scheduled him an appointment. But sent the wrong person.
They sent the wrong person?
Yeah.
How does that even happen?
I don't know. It's crazy, right?
Yeah, it's like a comedy of errors.
Totally. And he also says his spinal problems haven't been addressed.
Right.
And then he brings up this thing about toxin 7.
Toxin 7, what's that?
He doesn't really explain it.
Okay.
But he mentions another veteran who was exposed to it in Australia in 2021.
All right.
And this guy apparently has similar disabilities. And his wife had miscarriages.
Okay.
And Stephen's wondering why they're not looking into that connection.
Right. Like, is there a link?
Yeah.
Especially since he might have been exposed to something, too.
Exactly.
Interesting.
And then he talks about his kids' birth defects and his wife's miscarriages. And he says they're not connecting those to his potential toxin exposure.
Right.
In his VA records.
That's a huge deal.
It is. And he also claims that the VA knows his son's problems are probably from Agent Orange.
Really?
Yeah, even though he was stationed in Okinawa.
So that brings up the whole issue of where and when he might have been exposed.
Exactly.
And how the VA documents all of that.
Yeah, and we'll talk more about Agent Orange in Okinawa later.
Right, when we get to the Patriot Cabin community stuff.
Exactly.
Yeah.
Okay, so then he says the Chillicothe VAMC PTOT clinic wouldn't give him a neurology consult.
What PTO? That's physical therapy and occupational therapy.
Right.
So they wouldn't refer him to neurology.
Yeah.
Interesting.
And then later they said they couldn't give him PTOT because of paralysis, syncope, frequent falls, and left shoulder issues.
Wait, so the things he needs therapy for are the reasons they won't give him therapy?
Yeah, it makes no sense.
That's so frustrating.
It is.
So it sounds like there's a real communication breakdown there.
Yeah, for sure.
Okay, what else?
Well, he says they labeled him as a dirty vet.
A dirty vet?
Yeah, and that they denied him care because of it.
That's awful.
It is. And he also mentions a precancerous psoriasis condition.
Okay.
That he's had since the 90s.
And they're not monitoring it.
Yeah, he says they're not monitoring or treating it.
Wow.
And then there are even problems with transportation.
Transportation to his appointments.
Yeah, he says there were issues with the VA-provided vehicle, and it was hard to coordinate travel.
That's so inconvenient.
It is, and he's like, I'm totally disabled.
Right.
But VRE won't acknowledge it.
VRE, that's vocational rehabilitation and employment.
Right.
So they're supposed to help him find work.
Yeah, but they're not.
Wow. It's just one thing after another.
Yeah, it is.
So then he goes back to some of the medical stuff.
Right.
Like the adrenal tumor.
Yeah, the delays in reporting it.
Right.
The pituitary tumor and the unanswered questions from the MRI.
Uh-huh.
The positive test for malignant melanoma in Australia in 2021.
Okay.
That he says OSU didn't report.
Interesting.
And the lack of action on the basal cell carcinoma and renal cysts.
Right. So basically he feels like they're dropping the ball on all these major health issues.
Exactly.
And then he accuses them of retaliation and patient abandonment.
Yeah.
That's huge.
It is. He lists all these problems with his records.
Like what?
Missing records information uploaded wrong. He even names specific VA policies and directives that he says they violated.
So he's done his research.
Yeah, he has.
He's not just complaining, he's citing specific rules.
Exactly.
And he says the VA leadership has completely ignored him.
Yeah, he's tried to escalate things and he says nobody cares.
That's heartbreaking.
Okay, so we also have this record.
Okay.
Showing that Jessie, his wife, has also asked for help.
Oh, wow. So she's trying to get him the care he needs, too.
Yeah. She wants an investigation,
Uh-huh.
a full review of his records, a referral to a neurologist, a case manager, and a written response about how they're going to fix everything.
So she's advocating for him.
Yeah, she is.
It shows how much this is affecting their whole family.
Yeah, for sure. Okay, so that's his side of the story.
Right. A lot of serious accusations.
Yeah. But we also have this VA Blue Button report.
Okay. What's that?
It's like a summary of his VA medical records.
Oh, okay.
Dated March 2025.
All right.
So we can compare it to what he's saying.
Yeah, see if it lines up.
Right.
So what does it say?
Well, it covers February 1st to March 15th, 2025.
Okay.
And it includes info about that CT scan we talked about.
The one from March 4th?
Yeah.
The one they did because of the TBOs and migraines?
Exactly. And it lists his clinical history.
Okay.
You know, it says he had the brain MRI for TIAs in 2023, that he hadn't had a recent carotid ultrasound, that he doesn't see a neurologist regularly,
right,
and that he's just taking Tylenol and turmeric for his migraines.
Tylenol and turmeric, huh?
Yeah.
Interesting.
And it describes those blackout episodes.
Right, the ones they thought were ocular migraines.
Yeah, it's all in there.
So it's good to see how they're documenting his symptoms.
Yeah, and remember the findings from that CT scan.
Yeah. No acute intracranial abnormality.
Right.
Can say it clear as day.
Yep.
And the report also lists all the VA facilities he's been treated at.
Yeah, it's a long list.
Yeah, it really shows how long
Yeah.
and how complicated his journey through the VI system has been.
It's Tennessee, Ohio, Missouri, Georgia, California, West Virginia, Florida, Vermont, D.C.
Wow, he's been all over.
Yeah, all over.
He must have been transferred, or maybe he was seeking specialized treatment.
Yeah, who knows?
Okay, so now let's look at the Patriot Cabin community.
Okay.
This is a whole different perspective.
Yeah.
They focus on Gulf War era veterans and their families and the health problems they have from being exposed to toxins.
Yeah, like Agent Orange and depleted uranium.
Right, and this could be really relevant to Stephen Rickett.
Yeah, I mean, especially with all those unanswered questions about his MRI.
Yeah.
If he thinks he was exposed to something,
right,
then he's going to be looking for answers.
Exactly, and this organization tries to provide support and resources and just a sense of community for these veterans. They're even raising money to build cabins.
Yeah.
So veterans can have a place to heal and get away.
It's a really great idea.
Yeah, it is.
And they have this list of health problems that they link to Gulf War illness. And some of them are the same things Stephen says he has.
Really? Like what?
Well, they mention cancers, neurological problems, respiratory issues, autoimmune diseases.
Wow, yeah, those are all things he's talked about.
Exactly.
And they have this toxic exposure map.
Yeah.
And they specifically mention Agent Orange in Okinawa.
Right, and Stephen was stationed in Okinawa.
So that's a possible connection right there.
Yeah, it could be a key piece of the puzzle.
It makes you wonder if his health problems are related to that exposure.
For sure.
And they talk about the rainbow herbicides, too.
Yeah.
Not just Agent Orange, but Agent Blue, White Agent, Purple Agent Pink, and Agent Green.
Wow, a whole rainbow of toxins.
Yeah, it's crazy, right?
Yeah.
They were mainly used in Vietnam and Korea.
Right.
But they say Agent Orange was stored in Okinawa.
Yeah.
So veterans who served there might have been exposed.
Right.
And the Patriot Cabin community doesn't just focus on health issues.
Yeah.
They also try to help with veteran homelessness, suicide prevention, all sorts of challenges.
It's really important work.
Yeah, it is.
So when we put it all together...
Right, all this information.
It's a lot.
Yeah, we've got medical records allegations and this broader context.
And it paints a pretty disturbing picture.
Yeah, we've got a veteran with a service-connected tumor, unanswered questions about his brain, possible exposure to toxins, and all these accusations of negligence.
Right, and he thinks the VA is mistreating him.
Yeah, and he's not alone.
Right.
A lot of veterans feel that way.
Yeah.
It's a huge problem.
It is.
So the question is, what do we do about it?
Exactly.
What can we learn from Stephen's story?
Yeah, I mean, what does this tell us about the VA? About how they handle medical information?
About how they treat veterans?
Yeah, are they transparent? Are they accountable?
These are big questions.
Yeah, they are.
And they deserve answers.
Yeah, they do.
So for you, the listener, think about everything we've discussed. The medical findings, the allegations, the potential exposures.
Yeah.
What does this case highlight for you?
Right.
What systemic issues do you see?
Yeah, and what questions do you have about how we support our veterans?
Because they deserve better.
They absolutely do.
We owe them that much.
We do.